History at Higher Risk for Police Brutality by Michelle, Henry, and Chris. History of discrimination. The disabled community has a long history of being criminalized for their existence. The relationship between the disabled community and the U.S. criminal and medical systems begins with filthy institutions, isolations, experiments, pity, and murder. For many years, the disabled community has fought to transform their public image, receive human recognition, and gain access to civil rights. In this presentation, we will talk about the disabled community and how they are at higher risk for violence and mistreatment at the hands of the police. The problem. A large problem that is not commonly talked about is the fact that almost half of the people who die at the hands of the police have some kind of disability. This blog link talks more about this. According to a report published by the Ruderman Family Foundation, a disability organization, officers are often drawn into emergencies where urgent care may be more appropriate than lethal force, which usually ends up in a situation where a police officer kills the individual with a disability.
An example of police brutality. On May 25th, 2017, 22-year-old Adam Trammell, a diagnosed schizophrenic, began experiencing an episode of psychosis. Neighbors called 911 saying Trammell was naked in the hallway talking about the devil. 3 West Milwaukee police officers broke into Adam's home to find him standing in the shower, still naked and confused. Adam was neither armed nor behaving in a manner that would frame him as a threat, and yet because he wouldn't leave the shower like the police commanded, he was shot with tasers 15 times. The pain induced from these tasers was enough to leave Adam screaming in pain on the ground. 4 officers were called to the scene, where they dragged him out of his home, still naked, held him down, and injected him with sedatives. Not long after, Adam stopped breathing and was pronounced dead not too long after arriving at the hospital. All of this was captured by a camera being worn by the officers. Intersectionality of being black and disabled. People with disabilities already have a higher chance of experiencing police brutality. People of color are also at a higher risk of experiencing police brutality. So what happens if you're both black and disabled? Quote, "We are a minority of a group that's already a minority," says Isidore Nyongawa, president of National Black Advocacy. Activists have noticed the absence of minority voices in the disability rights movement for years. They point to a corresponding lack of disabled voices in the Black Lives Matter movement. It's a whole set of absences that worsens outcomes for disabled people of color who come in contact with the law.
The advocacy aspect. What efforts are being made to advocate for the disabled who experience police brutality? Many advocates want to decrease the total interactions police officers have with disabled people, redirect funds to other support services, and rethink law enforcement systems and protocols to better protect people. Crisis intervention programs are designed to help officers safely and calmly interact with people with disabilities and de-escalate confrontations with the mentally ill. People with crisis intervention training are taught to take a human approach where they talk calmly and reassure the person that they are just there to help. Advocates are pushing for officers to be required to have more training in crisis intervention programs, as officers who follow this kind of training have more positive results working with people with disabilities. This video link shows how crisis intervention training can be effective and helpful. In 2015, the ARC, one of the country's largest disability rights organizations, launched its own program to teach law enforcement officers, lawyers, victim services providers, and other criminal justice professionals how to identify, interact with, and accommodate people with disabilities. In Eugene, Oregon, the Whitebird Clinic runs what's known as CAHOOTS, Crisis Assistance Helping Out on the Streets. This is a program that reroutes 911 and non-emergency calls relating to mental health, substance use, or homelessness to a team of medics and crisis care workers. These teams respond to such calls instead of the police, not alongside them. The CAHOOTS program, which launched in the late 80s, receives roughly 24,000 calls each year. 17% of Eugene police calls are redirected to CAHOOTS, which can better use resources combating crimes. Police unions have criticized Cahoots and similar programs as they think that it's dangerous for medics and crisis care workers to respond to calls without armed officers. However, Tim Black, the Cahoots operations coordinator, says that's mostly not the case, as his team work closely with the Eugene Police Department, and last year just 150 of the 24,000 calls directed to Cahoots required police backup. Also, other cities have developed programs modeled after Cahoots, and many more cities are beginning to call for advice too. In New York City, a coalition of civil rights and social service organizations has proposed a pilot program for 2 precincts in which EMTs and crisis counselors would respond to mental health calls instead of police. Some activists argue that training programs, regardless of quality, are not enough, as nationwide protests and demands to defund or abolish the police continue. Some advocates are pushing for more radical models that seek to avoid bringing people with disabilities or those experiencing mental health crises into contact with the police. Overall, disability advocates agree that something must be done to stop the police brutality that the disabled community is at a high risk of experiencing.
How can you help? This advocacy website talks about how police brutality has been an urgent topic in the United States in recent months, emphasizing how we often overlook how police brutality affects people with disabilities, in addition to communities of color, and especially people of color with disabilities. Up to half of people killed by law enforcement officers in the United States have a disability, but the news media often does not cover these cases. This website encourages us to help advocate by sharing experience of people with disabilities, people on the autism spectrum, and family members of people with disabilities with nonprofit advocacy organizations and all levels of government, local, state, and federal. This website also encourages us to write down what you would like to express to your representatives or senators and to call their offices and make your voice heard. This website also suggests that you request a district office meeting and contact a member of their staff. It also provides a 5-action step page for further ways you can advocate for children and youth with disabilities.
Thank you for listening, and we hope you help us advocate for the disabled community.